Hi everybody, my name is Dr. Aaron Baxter. I'm with Synergy Radiology Associates and primarily work at Memorial Hermann Katy. Varicoceles are fairly common. Most of them are asymptomatic. So if you have one and you're asymptomatic, there's nothing that needs to be done. However, it can progress to something that is symptomatic, something that is more dilated, something that is associated with pain. If you and your partner are being worked up for infertility, it can be associated with abnormal sperm, both the quality and the quantity. So it's something to consider getting it treated. So in regards to varicocele surgery, definitely talk to your urologist about that option. One drawback is that it has traditionally had higher rates of recurrence compared to what we can offer in terms of embolization and sclerotherapy. So something to consider when comparing your options. So varicocele embolization is where we access a vein either in the hip or the neck area, and we select the vein that goes down to your varicocele, which is typically on the left side. So we would select the left renal vein, and then from that go down the left gonadal vein, and then we inject little tiny coils and then also a sclerosant to close down that vein. And you can have this done either with moderate sedation, which is a twilight medication, or you can have general anesthesia, which is where you're completely asleep. And we give medication to help with the pain afterwards. You can expect some mild to moderate discomfort after the procedure, and physical activity restriction for about a week, so no heavy lifting or strenuous activity for about a week, and try not to bear down too hard. But overall, it's very well tolerated, it's minimally invasive, we've had very good clinical outcomes. Regarding my personal experience performing the procedure, it is very gratifying knowing that we can do an outpatient procedure that is minimally invasive and can produce results equivalent to or better than surgery. It's something that I enjoy doing, and we do similar procedures throughout the body. So if you think that this procedure is something that could benefit you, please give us a call and we can talk about options. So there are options in terms of where you can get this treated for an embolization and sclerotherapy. There are several outpatient clinics in the Houston area that offer this. I think that an advantage of what Synergy can offer being affiliated with Memorial Hermann is that we have the peace of mind of being in a hospital setting. So we have the anesthesiologists, we have the cardiologists, we have the surgeons. If anything were to happen, not to say that there is any high likelihood of it, but if something does happen, you have the peace of mind, we have the peace of mind of taking care of it at the hospital and not being in a smaller outpatient clinic. So that's why, I prefer and I recommend to patients and family members to have it done in a hospital-based setting.